Welcome to the MUHC educational visit of the Trauma Center for blood transfusion and products. We're going to talk about how the blood is supplied to the hospitals, the tests that are done on the donors, the blood components and the blood groups, some examples of transfusion and the risks associated to transfusion as well as for the donors. So every day in Quebec, Héma-Québec, which is our supplier, needs 1,000 donations per day. A donor must be 18 years of age and older and can donate every 56 days. For donation, there's very strict criteria set by Héma-Québec. And at donation, there's an evaluation done by a nurse pre-donation. The nurse checks the donor's vital signs. That means your pulse or heart rate, your blood pressure, your temperature, and your hemoglobin from a small finger prick. The actual donation of the blood takes approximately 10 minutes, but the whole process takes about an hour. There's some criteria that Héma-Québec has that can defer a donor. The list is on their website. Please feel free to take a look. Every time a donor presents to a Héma-Québec donation for a blood donation, Héma-Québec does tests on that product. For example, they'll test for the ABO and the RH. They will also do tests for antibodies, as well as some viruses, including but not limited to syphilis, HIV, hepatitis B and C. Once the donation is at Héma-Québec and the tests are completed, Héma-Québec then fractionates the donation into various products. So they separate the red cells from the plasma. They then separate the platelets from the plasma, and each of these products is considered one donation to one patient. For red cells, the blood groups are A, B, O, and AB. The donated red cells are stored in a controlled environment for 42 days. They are transfused because of anemia or a possible surgical intervention, or because of a cancer treatment and the hemoglobin has dropped a little too low. Plasma, the blood groups are also A, B, O, and AB. The product is stored for up to 1 year frozen. Once it's thawed, it can be stored in the fridge for up to 5 days. The reason for a plasma transfusion is a deficiency in coagulation factors or for during a massive transfusion. Platelets, the blood groups are also the same, A, B, O, and AB. They're stored at room temperature for up to 7 days from donation. The reason for a platelet transfusion is to control a massive bleed, or if the patient has a platelet deficiency and the platelets are low. The major blood groups, as previously stated, are A, B, O, and AB. There's also the RH, the positive and negative. For Caucasian population here in Canada, the incidence of an A and an O blood product are the most. So the total of those two equals approximately 90%. For the non-Caucasian Canadian population, the blood groups the most common are O and A also. However, the percentage is approximately 70%. There's also the RH factor. You can be either RH positive or RH negative. RH positive being more common, that is 85% versus 15% for RH negative. Do you know how many liters of blood there are in your body? For an average adult, there's approximately 5 to 6 liters of blood. Do you know how many units of blood can be transfused at any one time? Well, that depends on the type of injury. For an accident or severe trauma, you might need a lot of blood. For a penetrating injury, you might need less. For a blunt force trauma, for example, to the head or to the abdomen, it's on a case-by-case. How many units of blood can be transfused in a 24-hour period? Again, that depends on the type of injury. The risks associated to transfusion. Well, there are some. For a donor of blood, there's very little. Just be sure to eat and drink post-donation. For a recipient of a blood product, and if it's during a massive transfusion, there's almost no risk. However, we do transfuse the blood products to our oncology cancer population, and there might be some risks to the patient upon receiving a blood product. For example, an allergic reaction. They could be scratching on occasion. There could be some hives because their body is receiving a foreign object, another person's blood, and they are reacting to it. It's an immune response. They could also present with a fever for the same reason. There's very little risk, however, to getting a viral infection from the donation. And the numbers are on the Héma-Québec website if you would like more information on that. However, the risks of transfusion are few as opposed to, for example, getting hit by lightning. The risks of death from a lightning strike is 1 in 350,000, and that's higher than a transfusion risk. If you have any questions, please feel free to check out the Héma-Québec website or further information on this site. Thank you.